What exactly is a bridge made of dental material and the reason why it is used? Dental bridges are an everyday dental procedure that replaces the missing tooth or teeth. They're basically an artificial set of teeth, which are held to the jaw by crowns that are placed on both sides of the space. Bridges are made from different materials like ceramic, steel, or a mixture of both. They are customized to fit the shape and color of the natural teeth. Why are bridges for teeth employed? There are a variety of reasons dentists may suggest the use of a bridge for patients with tooth loss. One of the primary motives is to enhance the look of your smile. Teeth gaps are unsightly and can cause patients to feel embarrassed regarding their smile. When filling the gaps by a dental bridge, patients can restore their confidence and have a more attractive smile. Apart from making your smile, bridges for dental also provide functional advantages. Teeth missing can make it hard to chew and talk properly, as well being a strain to the teeth around them. When you fill in the gaps by a dental bridge, patients can regain their chewing ability and talk normally and ease the strain placed on their teeth. Additionally, bridges for dental use can aid in preventing the teeth from moving from their proper position. If a tooth has been removed, surrounding teeth could begin to shift to fill the gap and cause problems in the alignment and bite of the teeth. When you fill in the gap using bridges for dental use, the teeth around it remain in position and the chance of shifting is minimized. There are a variety of types of bridges for dental use that could be utilized based on the particular requirements of the patient. The traditional bridge is the most popular type. They comprise a false tooth, or teeth that are held with crowns placed on both sides of the bridges that cantilever are utilized for when there is only one tooth only on one end of the gap, and Maryland bridges are a less invasive option, which uses the framework of porcelain or metal to keep the false tooth in place. To get dental bridges, one has to go to their dentist for an appointment. In this appointment, the dentist will inspect the mouth of the patient and decide whether a bridge made of dental material is an appropriate choice for the patient. If a bridge made of dental material is suggested, then the dentist will take impressions of the patient's mouth and then send the impressions to a lab to design the customized bridge. When the bridge is completed, when the bridge is ready, patients will go back to the dental office for it to be fitted. The dentist will first anesthetize the region with local anesthesia and then prepare the teeth around it for crowns. The bridge is then fixed in place, and patients will be leaving the dental office with a fresh and better smile. In the end, bridges for dental use are an effective and practical solution to replace missing teeth, as well as improving the look and functionality of your smile. If you are missing teeth and you are thinking of the possibility of a bridge made from dental material, talk with your dentist about whether it's the best choice for you. If properly maintained and cared for, a bridge made of dental material will last for a long time and allow you to enjoy beautiful and healthy teeth.